Before taking a new medications, the patient should consider, and us providers should encourage them to consider and ask questions about and definitely understand, why are they taking this medication? Why is it necessary? What is the therapeutic effect and endpoint of the medication? Do the benefits of taking the medication outweigh the risk of taking the medication? Is a medication to treat the effects of another medication, which, as we mentioned before, should not be prescribed or given or recommended? Can one medication be used to treat two conditions? Can this medication interact with disease or other medications? And does the patient or caregiver understand and know what the medication is for? How the medication is to be taken correctly, and what is the potential adverse medication effect of taking this medication? Non-adherence to medications may be as high as 50% among older adult patients. Predictors of non-adherence to the patient include asymptomatic disease, so they don't have any illness, such as when patients are taking antibiotics, they may feel well before the course of medication that's prescribed is completed, and they stop taking the medication. Inadequate follow-up, so they feel better, they don't come in to see us as we recommended or requested. Patients' lack of insight of the value of the treatment, again, not knowing why they're taking it or what actually it's supposed to be doing. Missed appointments or transportation difficulties should definitely be followed up on. Low to no health literacy. We should never assume that a patient understands or read what the language that they're actually speaking, and seek translation at every visit, and not from family or caregivers. Complicated dosing regimens, that they're taking two medications and too many doses in a day or over the course of whenever they're taking the medication for. And poor provider-patient relationship. If the patient does not trust us, they will not take the medication. If they don't understand, if we don't explain why, they will not take the medication. Non-adherence, continued. Interventions to improve medication adherence. Medication reviews and counseling to identify barriers, simplify regimens, and provide education. Telephone call reminders. Reminder charts and calendars have been shown to be less effective than actually a telephone call and speaking with a patient or their caregiver. Interactive technologies such as automatic pill dispensers to supervise, remind, and monitor medication adherence. Involve a caregiver if possible, and utilize weekly pill boxes or blister packs.
The screening tool of older person potential inappropriate medication, or STOP, is an excellent tool for providers to identify potential inappropriate medications, specifically for patients 65 and older. It focuses on areas of decreased risk of fall, medication contraindications, as well as polypharmacy and ineffective medications. So how to use this tool? First is medication review. Conduct a thorough review of all the medication the patient is on. Identify potential inappropriate medication. Use STOP criteria to flag those medications, inappropriate medications. Deprescribe if needed. Discuss with patients and caregivers medication that can be deprescribed, and monitor. Regularly monitor patients that takes medications.
Deprescribing is a systematic process of identifying and discontinuing medication. Consider, does the existing or potential harm outweigh existing or potential benefit? Not about denying effective treatment to eligible patients. Underprescribing is not the opposite. Positive patient-centered intervention requires shared decision-making, informed patient education and teaching to obtain informed consent, close monitoring of effective, similar processes of when medication is prescribed. So deprescribing tips, just like we had tips for starting, so deprescribing tips, reconcile all medications according to indication. Consider overall risk of the medication-induced harm. Assess medication eligibility for deprescribing. Prioritize which medication to address first. Implement deprescribing strategy and monitor plan. Drug facts equal total number of drugs used, of high-risk drugs, past, present toxicities, patient factors such as their age, cognitive impairment, comorbidities, multiple prescribers, and adherence, their adherence to taking the medication as prescribed. Potential or actual harm is greater than benefit. No valid indication, ineffective therapy completed, part of prescribing cascade, treatment burden, or safe alternatives. Final brainstorm. Is de-prescribing the responsibility of each person on an interdisciplinary healthcare team? And the answer is yes. Each person is responsible for helping this patient to take their medication safely. Appropriate prescribing means choosing the correct dosage of the correct medication for the condition and for the individual patient. Age alters pharmacokinetics such as medication absorption, distribution, metabolism, and elimination. Adverse medication effects are common but can be minimized with strict attention to risk factors such as medication-to-medication interactions and medication-to-disease interactions. Thank you so much for viewing our presentations. Again, I am Karlene Lawrence.
I'm Dr. Janna Roitman, and thank you again. If you have any questions, please contact us.